Hello everyone. So today I'm going to talk about hepatitis A. In general, hepatitis means inflammation of the liver can cause its function to be affected, and it is one of the most common types of viral hepatitis in the United States. So, what is the cause of hepatitis A? And hepatitis A is caused by infection with HAV and the RNA virus that is classified as pig coronavirus. This virus is a positive single-stranded non-enveloped RNA virus. So, according to the Center of Disease Control and Prevention, so after ingesting the HAV virus, it usually enters the bloodstream and travels to the liver. So HAV primarily targets the hepatocytes and the liver's primary functional cells. So once the HAV enters the hepatocyte, the viral RNA will be released into cells cytoplasm, and the transmission of the hepatitis A. So hepatitis A is primarily transmitted by the fecal oral route, and contaminated food and water are common transmission sources, specifically in regions where with poor sanitation, individuals do not practice proper hand hygiene can also lead to infection. And it also can be transmitted through physical contacts with an infected person. However, HIV is primarily a human disease. It's not common for it to spread between animals and between human and animals. So, how to prevent the transmission? Uh, well, the best way to prevent the hepatitis A is through vaccination with hepatitis A vaccine. Uh, other than that, the do a better job in personal hygiene, improve sanitation, and improve food safety, have a clean water source, and also when you go to public places to eat, have a clean plates and clean forks and spoons, etc. So as long as you maintain cut off the first contact with the virus, it should be help you to prevent getting the hepatitis A. So the symptoms of hepatitis A. Well, the symptoms of hepatitis A, once you have the virus, our immune system will start combating it. It will lead us have a feeling such as fatigue, high fever, yellow skin or eyes, don't have any diet, don't have any feeling to eat, throwing up, have a hard time to have urination, or you can't control or have maintained the flow of urination. So that's common symptoms of hepatitis A. So diagnosis and treatments of hepatitis A. So the doctor will observe patients' symptoms and also use a blood test to diagnose. Hepatitis A it is recommended for patients to drink plenty of water or eat healthy food to help relieve the symptoms. However, in severe cases, some patients are needed to be treated in hospital, or if the hepatitis A lead to other lead to liver dysfunction, liver transplantation will be needed. So the demographic of hepatitis A, actually, in hepatitis A infection is common in low and middle income countries where have poor sanitary conditions and hygiene practices. So in the U.S., is more common among homeless populations. However, hepatitis A do affect all people with all ages, but they have a higher rate among children and young adults. As the development of AI technology, so the doctors right now are having more tools to identify and analyze the whether or not patient have the hepatitis A. So the AI-powered image will will look at the patient's pictures, MRA, or those diagrams will compare with their data center to see and to confirm whether the patient indeed have a hepatitis A. And that will sum up my presentation. Thank you very much.